it's got to be stressful.
Obviously, she's not working, and he's filing for divorce.
Well, do you really? I mean, I don't know what to say there. I mean, they bought a house. She's maybe.
Yeah, but if you think about it like that, I think about like it's like if he's filing for mental cruelty, he can't really say or do anything, so you don't really know if she's actually doing anything. But on the second thought, though, you don't really know, like you said, what kind of stress she's dealing with. You know what I'm saying?
That's pretty, if he's filing grounds for divorce, that's pretty strong, pretty serious, and you wouldn't do that because financially that's gonna be a real hardship for him, so he must really be in a bad position if he's.
You must remember though, he's only partially paralyzed. Okay, so he's not fully. We don't know the scenario.
She's
And really,
highly successful stockbroker.
and you know, maybe that's more of a legal scenario than we know personally. But let's look at the next father.
The next one is Father Masallo. He is 58 years old, master of a parochial school, serves disadvantaged Native American children in New Mexico. He's a specialist in counseling troubled young children.
Well, I would say with this whole list up, I would put him as number one.
Me too. I just think that what he does is commendable, and he's helping children, and he has he's 58, he is on the older side, however, he still has a good 30, 40 years.
I would say that too.
So does everyone agree?
Yeah.
Okay, so for sure, Father Masallo. Okay, Thomas Washington, 19 years old, freshman at NY University. He lives with his family in Harlem. His father recently died, and his mother is sending him to college by using the life insurance money. He is majoring in art history. I think he for sure is. He's 19, he's going to college. This is going to be his last chance.
I mean, there's no doubt. He's young. He will be able to support his mother. She's making the sacrifice, and also.
Yeah, to use the life insurance money. I mean, that's a huge sacrifice. What do you think? Do you agree?
Well, we can come back, but I'll tell you what. Here's a scenario where you just have a mom
with
and
the 19-year-old getting
you have a mom and a son, and who's really, I agree.
Because he's going to college, he has a long life
What's
to
the
live.
problem? I don't even
Yeah.
like,
What's the concern?
What are you saying? Wait, what are you saying about life insurance?
Right down here it says that his mother used the life insurance money from his father to send him to school. So if he dies, there's now no more money left in the family.
Oh, okay.
She's banking on him to go to school to take care of her. Right.
Okay.
Do you agree?
Oh,
Yes.
yeah, I didn't see that. I don't know why I didn't see that.
Okay. So we have two hearts. All right, we have 2 hearts left over. I think everyone should go around the table and see who everyone thinks should get the next 2 hearts, and then we'll see if we agree on anyone.
Dr. Emily, Dr. Licker, would you like to start?
I would go with probably Donna and Mary, the kids, and then the scientists.
You have Donna and Mary?
Yeah, Kevin, who would you say?
Donna and Peter, 9-year-old.
Okay.
I would say the same, Donna and Peter.
Oh, Deb.
Because I'm a mom, I'm really stuck on giving it to Mary because I really think that children should have their mother, especially at that young age with teenagers. I don't care if she's in bed or not in bed the rest of her life. I would want my mother there. So I think that Mary should have it, and probably Donna. Mary and Donna.
So you don't think Peter, the 9-year-old?
So it sounds to me like we all agree that Donna should have a heart. Is that true?
No.
Oh, I'm sorry. Okay.
Mary.
No, they did Donna.
They did Donna.
Okay, what have you said, Dr.
Mary?
Dr.
I'm
Rowland,
sorry,
what have you said?
you did not answer.
I like Mary for sure, just because I know from
Okay.
being family wise, I mean, you can't.
Okay, and then who else?
This is a very difficult decision.
Well, no, it's up to Dr. Ted. So I mean,
It's a very
you got to.
difficult
It is
decision.
very difficult. That's why we're
The
here.
9-year-old, you wanna give him a chance.
Okay,
I
wait,
think
wait,
he has
Doctor,
a good
Doctor
What
Debbie,
happens
we gotta see, who do you say? We only have about 10 more minutes to
We
make
have
this
less than
decision.
that. We have probably like 3 more minutes.
I'm just saying out loud.
Okay, Dr. Debbie, who do we have now? How many do we have for
I'm
Mary?
gonna go with
Right now.
Mary.
Who
For
do we
Mary,
have?
we have 3, for Donna.
Wait, for Mary we have who?
3.
We have Teddy and Debbie.
Dr. Rowland, Dr. Leaker, and Dr. Rowland.
Wait, okay, so we have Teddy,
These three.
we have, okay, for Mary is Teddy,
Deb.
Emily,
And
Yeah.
Debbie.
and Debbie,
For
okay.
Donna, we have Kevin,
Kevin,
Chip,
Chip,
Doesn't matter who wants it.
Emily, and Debbie.
okay, Emily, okay. So Donna, so we have, so all of us are picking Donna?
Except for Teddy.
No, I don't like that.
Okay, what about Mike?
No,
No.
he's a goner.
Anybody? For Mike?
No.
Screw him.
Okay,
I'm thinking more about Peter because
Okay.
if he gets a new heart, I'm thinking he can like do something.
Yeah, I agree with that.
So-
okay, so who do we have for Peter? I know
agree
there's
with Peter,
Kevin
too.
and myself,
I do agree with Peter.
Yeah.
Okay.
Because they-
okay,
The
and
family
Teddy.
lost their
Now what do you,
son.
now,
Take away
You're
Donna
right.
and go for
The
Peter.
family
You're right,
lost the
he's
son.
right, the family's already lost one son,
Right.
that's absolutely
But
true.
I think the Mary, I mean, like, what's the point of wasting a heart? She has a chance of dying from being
okay.
overweight.
So then are we gonna pick Peter?
That's
Let me
Donna.
ask you. Let me ask you a question.
Yeah. It's
What happened
What if it was your mother?
If it was your mother?
But if
Whoa,
Well,
whoa, whoa,
you
what
can't.
if it was your mother?
I would love, but I would rather go to. I mean, it sounds bad, but I'd rather the heart go to someone that's really gonna be useful
The fact that
too.
she's
If you're
overweight.
in this situation, you
If
would
it,
want your
if
mother.
it was
Right.
you
Yeah.
and 5 of your brothers and sisters, and you had a little sister that was almost the age that my sister was,
I agree
would you
with,
take her mother away?
Yeah, but you gotta
I-
let them
you
lose
know what,
someone else's
though?
life.
it's not even taking your mother away though.
You're losing
Or
someone else's
would
life.
would you be looking at somebody who could possibly,
You benefit from the heart.
with Donna, who has the PhD in physics and all that, who could figure out, possibly diseases or whatever could be, she could develop, she could find, she could, what's the word I'm looking for?
Discover.
Develop, discover.
She doesn't have any children though, she
Yeah,
doesn't have
but
any
doesn't
family.
mean she
But
won't have
she
children.
can create and keep life
Family?
going or making. Who knows? She could be the next.
The extreme weight problem is because I mean she could die the next day after she has a
Exactly.
heart goes to
There
waste.
is no guarantee that
The
she would.
reason she probably though has an extreme weight problem, I
But
mean,
you
we
don't
don't
know
have
that.
her case in front of us, but, which we probably should have gotten the files for that. However, with not knowing that, my guess would be if I was bedridden, you become extremely overweight. Once you have a new heart, you can start exercising and those things can get better.
Okay, so let's call the hospital. Okay, we're gonna call the hospitals and let them know that yes for the Father Masala, yes for Thomas Washington.
And yes
Oh,
for Peter Gershon.
Okay, and yes for Peter.
So now it's
Is
either
that
Donna
correct?
or Mary.
Yes, so
Okay.
so we have a 9-year-old that's going to get a
Okay.
heart, a 58-year-old, and a
Okay,
19-year-old.
okay. Well, let me ask you this then. So we have Mike Carbona, he's out, and what about Terry? She's
She's
27. Okay, she's out.
She's gone. It's either the top two.
Okay, so now we're unanimous with everybody but Donna or Mary.